So like I said, a couple of cases where the things that we see clinically and the things that we see radiographically may not always translate to the things that we're seeing intrasurgically, okay? So unless I have a CT scan, I may not necessarily know that this ridge is quite narrow. When I palpate it, it may feel rather full, but when I go in, you can see that it's quite hourglass in configuration. And what I mean by hourglass is when I'm looking down on it, it pinches in where I want to place that implant. So these are areas that have to be site developed, and this will be part of subsequent seminars that we'll do in the facility as we'll talk about bone augmentation procedures. I'll try to get a gauge as to individuals that are going through the introductory course on implants who wants to start doing more bone grafting at the time of extraction, who wants to do more bone grafting at the time of, you know, when you see an edentulous ridge. What we really think is important is to start identifying those cases that are either borderline, may require some bone graft material, or those cases that are, let's say, ready to go for implants. And those are where you're going to get your confidence really built up in terms of utilizing a facility like this and starting to place. Because I can tell you even right now, even being tutored on some of the more simpler cases, it may seem very overwhelming starting to get introduced into implants. Having a tutor or having a mentor at a facility like this that will actually guide and show you, how to correct for the implant position, the orientation, the angulation is really critical in getting confident with actually placing implants.